So today I'm going to be talking to you about spontaneous spiritual awakenings. As I've mentioned, I'm going to quickly delve into my own journey and what led me on this route to want to understand the experience better. And then I will talk about what we know so far from a psychological standpoint on the experience. And then I'll conclude by explaining why I feel it's so important for us to engage in conversations around spontaneous awakening experiences, and also why I feel it's so important for us to investigate the experience from a more scientific or academic standpoint as well. So without further ado, I will actually start off by describing my own experience very briefly to give you a little bit of context and reason why I undertook this route. So just over 5 years ago, I had just moved to Madrid. I was very excited. It was a very exciting time of my life. I had just changed jobs. I was living a completely different life. And I think it's important for me to mention at this point that I had been raised atheist agnostic, so I had never really been exposed to any esoteric or spiritual context at the time. And I almost rejected anything that was remotely what some might call, what one might call spiritual. I didn't know anything about energy centers or anything of the sort, and especially not of Kundalini experiences or spontaneous awakening experiences. And that's until one morning when I woke up from a very intense lucid dream. And I won't go into depth into the lucid dream. That would be a story in itself. But when I woke up to a new day, and I also woke up to a new reality. So I opened my eyes and everything around me just came alive. Everything had this incredible life quality, this beautiful sense of beaming with life energy. And the colors were extremely vivid, and the hues and the shines of everything around me just came alive and were beaming with radiance. And I had this sense of love permeate through my every cell in my body, and a sense of connection to everything and everyone, the animate and the inanimate. I felt deeply connected, but it wasn't a thought concept. It wasn't something that I was talking myself into. It was a felt experience. It was a noetic experience of communion with a universal consciousness, is the best way I can describe it. But due to the very nature of these spiritual experiences, it's also very difficult to express them with words, and particularly through English language, which doesn't really cater to a more spiritual kind of vocabulary. So I had an incredibly blissful experience. I cried tears of joy for what felt like hours and was probably seconds or minutes, because time and space change when you're in that state of consciousness. And I decided from that moment onwards that I wanted to dedicate my life to understanding these experiences better from an experiential point of view, but also from a more academic point of view. And I'll explain why in a moment. So as months went by and this feeling stuck with me, I started to realize that despite the experience being super blissful and beautiful, I was unable to feel comfortable with sharing that experience with other people. And this led me to wonder and to question the system in which we find ourselves in, and the fact that we don't really have a safe container, at least in this Western world, through which to express these kinds of altered states of consciousness or spiritual experiences. And so I turned to the internet, I turned to spiritual literature, and I realized more and more, the more I delved into these topics and into other people's experiences, I realized that I was not alone, and that many others had had these kinds of experiences through time and even now. And B, that these experiences were not always predominantly positively felt, and they could be also very difficult and challenging for people. And that led me to want to understand the experience more, just out of curiosity, but also in order to acquire the tools to then go on to pursue a career in psychology, to try and change things, even if in a very minimal way, in a very, very minimal way, to try and change things from the inside. And so I found David Luke, who I knew was specializing in psychology of altered states of consciousness. And I really admired his work. And I knew that I would be able to undertake the research that I wanted at the University of Greenwich. And so I didn't even have any doubt in my mind that that was the right course for me. So I left my job, a very stable and very good and exciting job, and I changed it for a more exciting life. And here's what we found during our investigations of spontaneous spiritual awakenings. And I'm just going to share my screen here for a moment. I think you can all see that. Do wave if you can't. So we've already discussed what spontaneous spiritual awakenings are. This is a definition that I gave for my research project, for our research project. So they're experiences of a sudden or spontaneous nature where an overwhelming sense of connection, communion, or complete non-dual merging or experience of oneness with a divine consciousness or ultimate reality is felt. And the experience, as already mentioned through my own, is usually felt as an experience of connection or as oneness, of bliss, peace. People often report senses of undying and infinite love. They're noetic, they're ineffable. And people often describe feeling an immense sense of gratitude and of well-being, enhanced creativity, curiosity, and also altered time and space, as mentioned. Something that I found very interesting from my own experience as well was a reduced sense of anxiety. And not just any anxiety, but I had a clear sense that all would be well after death as well, which is very odd because I don't think I was anywhere near my time of death at the time. But this was a very strong sensation that I received in that moment, in those moments and up until now, I suppose. And occasionally these experiences can also be intensely physical, as is most often reported through Kundalini awakening experiences. So people often report this sense of heat or electricity emanating from the body, typically moving from the base of the spine all the way up to the crown of the head. And sensations of luminosity, of light emanating from the body, from different energy centers in the body. The one I felt was a sense of light emanating from my heart space, from my third eye space, and from the crown of my head. And do bear in mind that at the time, I didn't know anything about these concepts, though intuitively I knew exactly what this was all about. People might experience disruptions to the digestive and reproductive system, so they might purge. And I have spoken to many people who experience who have experienced involuntary movements of the hands, so the hands going into different mudras or hand gestures, and different asanas, so yogic postures as well. And occasionally these experiences will extend to more paranormal-like experiences. So commonly reported actually are increased synchronicities or coincidences. Archetypal visions are also quite commonly reported, and then less commonly reported, but still that still occur, are senses of telepathy and feeling spiritual presences or seeing things or hearing things that are not produced externally. What one might refer to as a hallucination, but I don't like that term because it kind of dumbs the experience down and it makes it seem less real. And in fact, these experiences are often considered more real than reality. So just to give you a bit of context of the research that has been done on the psychology of these experiences, and I'll integrate a little bit about our research into this. The experience of spiritual awakening can be had gradually, but we're not going to focus on that for the purpose of this talk, or they can occur with no apparent trigger, though this appears to be less common. The experience can also be preceded by spiritual contemplative practices such as yoga meditation. I've spoken to many people who experienced it during a Vipassana retreat or silent retreats. Spiritual literature might trigger something in the mind and make people become more aware of the true sanctity of their existence. Contact with nature is a commonly reported preempting or preceding factor to the experience, but most commonly reported, both in our studies and in many other studies that came before, is psychological turmoil. So the most reported preceding factor to awakening experiences of a spontaneous nature is psychological turmoil or trauma. So as we can see from these preceding factors, the experience is not always mediated by the experience's spiritual or religious context. And this is evidenced also by our own research, where over 50% of all participants claim to be spiritual but not religious, and a very small percentage adhered to a particular religion. And these experiences might occur more commonly than we think in widespread population. And I think this is really nicely kind of portrayed by this Gallup study from 2002, where 41% of 1,509 participants, projecting to 80 million American adults, fully identified with the statement, "I have had a profound religious experience or awakening that changed the direction of my life." That's 41% of 1,509 participants. That's a lot of people. And of course, this is just speculation, but it warrants a lot more investigation. 25% of those people reported no religious preference, which is also an interesting statistic. Whether short or long lasting in their peak effects, the experience is almost always drastic and leads to long lasting effects. And this can trigger increased physical and mental well-being. I've spoken to people who described having had physical ailments, chronic physical ailments, who then felt as though the spontaneous awakening experience cured their ailment and they didn't have their back pain or neck pain anymore following the experience. People will often become more environmentally aware and more able to engage with human beings and also with animals. And an increase in pro-environmental behaviors also means that people are more likely to want to protect their environment. So it leads to beneficial effects. Of course, then awakening experiences can trigger a liberation from past attitudes and beliefs, and often people change their religious or philosophical views. Particularly notable is a moving away from religion or religiosity towards a more holistic kind of term or understanding of spirituality, and a moving away from materialistic lifestyles as well. So people tend to become less engaged in their appearance or in materialistic activities such as shopping and so on. And of course, the liberation from past attitudes and beliefs coupled with a higher sense of purpose usually means that people change their career paths and also their relationships. So these experiences, whether short or long lasting, really do seem to have very strong subjective effects on the experiencer. And that is clear, and we've observed that, but the experience of awakening can also trigger objective positive effects. So in other words, measurable positive effects, both in induced and in spontaneous experiences, such as a decreased risk of committing suicide amongst suicidal individuals, the treatment of treatment-resistant alcohol and tobacco addiction, and many studies have actually alluded to a 3- to 4-fold increase in abstinence from post-awakening from addiction. And even the whole basis of Alcoholics Anonymous program and other 12-step programs is spiritual attainment, or as they call it themselves, spiritual awakening. They use that terminology. Even Jung proposed spiritual awakening as a means of freeing oneself from addictions. And of course, psychedelic-assisted psychotherapies are also pointing the finger at in the right direction, in the sense that mystical experiences mediated by psychedelics have now been shown or are being shown to help with the treatment of treatment-resistant addiction, depression, and reductions of anxiety, hopelessness, and fear of death in people in palliative care. So people with terminal illnesses such as cancer. And there's many more investigations being done on that. And I will put a list of research articles that you can consult at the end of this presentation. And then finally, in terms of changes, these experiences often lead people to become more interested in spiritual-based lifestyles. So people will often engage in spiritual practices such as yoga meditation. They'll spend more time in nature typically. And all of this equates to an improved positive identity and sense of self, improved coping and problem solving, and in turn, and this is like an upward spiral, that in turn decreases psychopathological tendencies. And we can see this in our own research. This is just a very easy example to give you. In our own research, we asked people whether they regularly practiced these following spiritual practices or holistic practices. And we can clearly see here from the before to the after, the difference in percentage is notable on all levels, on all practiced activities post experience of awakening, with a small decrease in the intake of psychedelics and entheogens, though that might not be very significant, and more investigation needs to be done on that. So what did we find in our own research? So the research that me and Dave recently published, there were a number of things we were looking to find, but this is just a brief summary of what we did find. So first of all, we understood that, we wanted to investigate whether spontaneous Kundalini awakenings, which are more typically reported by people and also in transpersonal literature and yogic scriptures as being more physical in nature, we wanted to understand whether they were in fact perceived as more physical by the participants of our study. And we also wanted to understand whether the physicality of the experience, or rather the intensity of the physical experience, was correlated in any way with the intensity of the negative experience. And what we found is that spontaneous Kundalini awakenings were significantly more physical. So that is something that we had predicted, but not necessarily more negative than what people might refer to as spontaneous spiritual awakenings. And of course, the definitions between these two experiences are very loose, so it is difficult to sort of unpick that. But we did want to, as a preliminary study, investigate the differences and the similarities between spontaneous Kundalini awakenings and spontaneous spiritual awakenings. Okay. We also found that overall, the experience was perceived as predominantly positive in both short and long terms, with a clear increase in positive outcomes in the long term, which would suggest that even after a difficult experience in the short term, or a difficult experience initially, more people were likely to report it being a positive overall experience in the long term. We also wanted to investigate whether temporal lobe lability and trait absorption were good predictors of the spontaneous spiritual awakening experience. Temporal lobe lability being synonymous of the epileptiform disturbances in the temporal lobe, which might be indicative of temporal lobe epilepsy, and trait absorption just measuring the depth of engrossment without attention or control towards a given subject or experience. And we found that both temporal lobe lability and trait absorption were predictors of the experience of awakening, of sudden spontaneous awakening. What does this mean? Well, it simply means that people with a higher tendency for disturbances in the temporal lobes were perhaps more likely to experience spontaneous spiritual awakenings, and particularly those of a more intense feeling. And the inverse is also true. And that trait absorption also was a good predictor of the experience of awakening, in the sense that if one has a that the level of trait absorption that one might have might be a good predictor of the level of spontaneous awakening that they might feel, the intensity of it. Finally, we wanted to map the altered states of consciousness, so drug and non-drug induced altered states of consciousness with spontaneous spiritual awakenings, including Kundalini awakenings. And we found that spontaneous spiritual awakenings were overall considered stronger experiences compared to all measured altered states of consciousness. And most similar phenomenologically and in depth of experience, so in intensity of experience, with strong doses of DMT and psilocybin. We must take this result with a pinch of salt, however, because we compared most powerful spontaneous spiritual awakening with one-off doses of DMT and psilocybin and other altered states of consciousness. But this does lead us in the right direction to better understand the comparisons between awakening experiences of a spontaneous nature and perhaps mystical experiences, including awakenings that have been triggered through different means. And just by means of showing you in a more visual way, this is our data. So in orange, we have the spontaneous spiritual awakenings on the 11D ASC scale, measuring a number of different characteristics or qualities of an altered state of consciousness. And the blue is DMT experience, and in green we see psilocybin. And we wanted to go a little bit more in depth on the DMT experience, and we found that, as predicted, the DMT full mystical experience was more similar, both in its phenomenology and its depth of experience, to spontaneous spiritual awakenings compared with DMT sub-mystical experiences. And just by means of comparison, these are spontaneous spiritual awakenings compared with non-drug induced ASCs. So we can see there's a clear difference there in their similarities. Now, why this path? And I'm going to take a sip of water. Right. Well, there are many reasons why one might want to undertake a research on spontaneous spiritual awakenings and in spiritual experiences in general. The first thing that springs to mind for me, and one of the most important reasons, is spiritual emergence or emergency support. Spiritual awakenings, as we've discovered in this talk, and as most of you might probably know through experience, can be positive, can be incredibly blissful, and can lead us towards pro-social, pro-environmental behaviors and heightened well-being. But the experience is not always all that beautiful and comfortable. The experience can also be really difficult to manage, particularly as the subject finds themselves stripped of all pre-existing understandings of the world around them and of themselves. So all the layers of conditioning might have evaporated and disappeared. And the experience can be challenging either during the initial stages of the experience or also during the integration period. And because the experience of sudden or spontaneous awakening is usually held outside of a spiritual context, with people not necessarily knowing what's happening to them at that moment because they haven't been exposed, for example, to spiritual literature or concepts that might help them, give them a framework through which to interpret their experience, they're more conducive usually, or so it may seem, towards spiritual emergency or crises or difficult experiences. But whether positive with some challenging characteristics or difficult experiences, spontaneous spiritual awakenings are paralleled typically with psychopathologies in mainstream psychology and psychiatry. And I believe that whilst the overlaps are evident, they still need to be picked apart in a way that is comprehensive and robust. But I do believe strongly that the experiences need to be investigated as experiences in their own right. That might occur void of any kind of underlying psychopathological tendencies such as bipolar disorder, psychotic breaks, or schizophrenia. And despite best efforts on behalf of transpersonal psychologists to introduce a new diagnostic chapter in the DSM-4 in 1994, spiritual awakenings are still overwhelmingly more likely to be pathologized, and even positive experiences as such, and people are likely to be medicated, unfortunately, in these states. And I believe this is because this is due to a lack of spiritually informed clinicians, and also to a very limited understanding of what it means to be a human, what it means to exist in this world, in the Western kind of conceptualization of our human experience. Of course, the improper treatment of people undergoing either difficult awakening experiences or positive awakening experiences with challenging aspects to it can result in trauma. And it might take years and years for people to overcome that trauma. So I feel it's incredibly important that we use research in order to inform and better equip clinicians and mental health workers on how to best handle the experience of awakening. And so far, again, transpersonal psychology has come a long way and has worked wonders at trying to bring this to the surface. But I feel like the branch of transpersonal psychology is still very much kind of put to one side by clinicians who might act as the first point of contact with the patient. So it's important for us to bring it to the mainstream as much as possible. And we're starting to understand more and more. Obviously, this is, one might expect so, but we're starting to uncover also from a more scientific perspective the effects of peer support and validation, and the roles that they play in enabling a more a safer and more beneficial way of treating patients who are undergoing these experiences. And finally, why is it important to develop the science of spiritual transformation? Well, it's also important for us to inform through research well-being practitioners and holistic practitioners who are working perhaps daily with clients who might undergo either positive or difficult states of consciousness. And the more, again, this is brought to the mainstream, the more yoga alliances will take note of this, the more yoga practitioners will take note of this, and so on and so forth. In my own yoga training, which was fascinating and wonderful, and I love it, we weren't given any training on this. And so I think this is really an area that needs to be developed. And of course, it's also important for us to investigate these experiences in order to develop more effective practices and effective and safe ways to unleash human potential, either for the treatment of mental health disorders or simply to unlock human potential in people who do not have psychopathologies, who are simply, undergoing life in their everyday life, and they just feel like they need to experience more from it, because altered states are a birthright in essence. And finally, the more we research these experiences, the more we can increase awareness and understanding of what spontaneous spiritual awakenings actually are, the less misinterpretation can be had by members of the general public, and the less stigmatized these experiences will be. The less stigmatized they'll be, the more normalized they'll be, and the more we can enhance and facilitate a more compassionate understanding and united world through the facilitation of these experiences in safe containers. And that's all from me. I hope I didn't go over time. Thank you so much for listening. I am really happy to be here. And Dave and I will now be taking questions. I just wanted to share my resources with you. Obviously, you have the Emerging Sciences Foundation, but if you're undergoing, or if you know anybody who's undergoing spiritual emergency or who simply needs some validation, please do consult these websites and these organizations. And here's a link to our publication. You can contact me. Thank you.
Thank you so much, Jessica. Clap, 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 clap. That was awesome. Thank you so much. And thank you for being there holding space as well, David. I'm sure that was enormously comforting. So that we've got a couple of questions that we can dive into. And, you know, it's very much around this sort of the birthright of human life to actually be able to experience altered states. And in fact, on our own website, we say that Kundalini has the power to revolutionize our understanding of all major aspects of human life. So if we can sort of take that sort of springboard for questioning, I'm just going to go into an actual question that I have here and see which one of you would like to take it. What kind of understanding would you both like to see in the community of mental health care practitioners? For example, let's say in the United Kingdom's national health system, and how that relates to spiritual awakening. Which one of you would like to take that one?
First of all, just say what an excellent job you've done there, Jess, and well done. So glad you presented that. Yeah, I think mental health care workers, I think on every level should have a better appreciation of the transpersonal realms, including Kundalini experiences, mystical experiences, spontaneous spiritual experiences, but there's a whole range of experiences which, you know, previously have been pathologized, and that includes things like, you know, experiences of telepathy, out-of-body experiences, even near-death experiences are poorly understood. I think there's an increasing awareness, certainly in the kind of academic world within psychology, but it's still yet to penetrate into the general clinical practice, I think. And I, you know, in my work, I'm constantly contacted by people who are at a bit of a loss because they are having these kinds of experiences, and their therapist or their psychiatrist or their family and friends don't really have an understanding at all about these experiences. And so there really is a need for just greater education really around all kinds of transpersonal experiences. But I think it'd be great if everybody had some kind of transpersonal training in their clinical work, particularly if they're working with mental health and psychiatrists and therapists and the like.
Well, hear, and heart. You know, I mean, that sort of brings into the seemingly common reality that awakening is accompanied by trauma, or let's say the process of awakening causes trauma, or indeed trauma causes the awakening. So that was sort of almost bridged straight into your, you know, both of you, where you're sort of championing for healthcare workers to really be much more integrated into the topic, so that they can help us before, during, and after this birthright, correct? So you're nodding, Jessica. Do you want to come in there and say how you feel?
I just echo what David said and what you said. I think it's really important for us, for clinicians, mental health workers, to be aware that these experiences, that altered states of consciousness, particularly those that are had endogenously, can happen, can occur to people, and they're not necessarily conducive or experienced through mental health disorder. That at least is what the conclusions that I'm coming to from my own research, from my own experience as well, and from the experience of those that I've interviewed and that I've spoken to. So I think we need to pick mental health disorder apart from spiritual awakenings or altered states of consciousness generally, because I don't think that one necessarily implies the other. And sure, there are overlaps, but yeah.
Yeah, no, thank you. Very well stretched.
Jump in there. Sorry.
Yes, David, please.
To add a little bit to what Jess is saying, she raises a really interesting point, an important point, is that it's one thing, you know, I do a lot of research primarily with psychedelic experiences, of which there are some parallels, because we have these kind of induced mystical experiences through the ingestion of, you know, magic mushrooms or whatever it might be, which are kind of short-lived and induced rather than spontaneous. And so people may come to expect that might be an outcome of having had psilocybin or magic mushrooms, but when people have these experiences spontaneously, they're probably much more quickly labeled as in some way aberrant or pathological. And I think there's a more serious danger there of stigmatization and misunderstanding. And interestingly as well, the work with psychedelic in the clinical context with therapy, which is now receiving a great deal of attention, is kind of raising the attention of the importance of mystical experiences in better clinical efficacy in the treatment, as Jess said, of things like depression, anxiety, and addictions. And if we can look to the spontaneous varieties of those experiences, I think there's a lot we can learn about how we can improve mental health, generally speaking.
Well, absolutely. I mean, we must all champion this. I mean, everything that you've just said. I mean, we are very short of time, but David, if you could just answer very quickly. I mean, you stand up and talk with many audiences. I'm sure they're quite mixed audiences, are they? And they're nationwide and worldwide. Just a quick answer. Are the right type of people showing up, meaning the right mix? Because you want a mix of all these people coming in to at least just hear, don't you? Can you answer that very quickly for us? And then we must say goodbye.
Sure, absolutely. I mean, often you're preaching to the converted, but yeah, I give an awful lot of public lectures, and I'm always amazed and surprised that you get people from all walks of life. And you know, I think there is an underlying interest in these subjects, which isn't reflected in the amount of research and kind of media attention that they receive. I think people scratch the surface, and everybody has a deep calling towards the spiritual. And so I think everybody has an underlying interest in it.
Well, thank you both so much for answering our call to come here and be with us at the 2021 Emerging Sciences Foundation Symposium. It's been outstanding. And Jessica, bless you, really, really good. Thank you so much. David, thank you for bringing such wonderful minds like Jessica to the table and to the floor. So keep it up the good work in Greenwich. Bye-bye.
Thank you, Susan. Thanks, Jess.